Lucas. How are you?
Hi, not bad.
That's good. So I'm going to go over all of our discharge stuff today from the surgery. So Luna did great for us today. Not that you should be surprised. She's a cute little girl. So this sheet, we have a copy here. We're going to have you sign off. We're going to send it home with you as well. Okay. So just want to thank you again for letting us help take care of Luna today. Again, she was such a great girl. It's a joy to have her here. The first thing we want to kind of go over is diet, because you know she hasn't eaten in a while. You're probably gonna be worried, hey, what can I feed her? Can I give her food when I get home?
Yep.
She has been awake for a little bit, so I usually recommend when you first get home, give her like an hour and then place a small dish of water down to see if she's interested. Because she did receive IV fluids today, she might not want to drink a lot. If she's not interested or drink anything, then give her like another half an hour to an hour, and you can offer a small meal. I usually recommend that you're going to do about a quarter of what you would normally feed her and just see how she does and if she eats it and keeps it down. If you guys are up for a while tonight, you want to do another small meal later this evening before bed, that's fine. But then tomorrow she can go back to her regular diet, regular amount, okay? Now, of course, activity. We do want her to be restricted. The first 24 hours, she could still be drowsy and sleepy, so we want to make sure she's not left unattended. If you have to go anywhere, go to work, or just, you know, at bedtime to be safe, you can put her in her kennel. We do want to keep that e-collar that we talked about this morning on all the time.
Okay.
If she's having any trouble with eating, you can go ahead and take that off so she can eat and drink. But the minute she thinks that she's done and she looks back, just put that collar right back on, okay? So the medications, we're going to go over that. Like I said, she got some injections today that will help keep her comfortable, but we'll go over when she needs to take her next oral dose of medication. The next 10 to 14 days are going to be the most critical for her. We want to avoid any type of jumping up and down, stair climbing, going on walks. I usually recommend waiting about, at least the first 5 days, keep her rested, and then just taking her maybe up and down the block, or even just a perimeter of your yard, but always on a leash.
Okay.
Leash is really important, even if she's used to going outside in your backyard, because if she gets the zoomies and decides to take off, she can cause a lot of injury to herself, okay? Now the incision site itself, we certainly don't want you to have to apply anything, and just let it as it is. If you notice any odor, drainage, anything like that, please give us a call and let us know. Occasionally it can be normal, but we'd rather just check it to be on the safe side. Okay. Now today it's going to be a little red and swollen, and that's expected after surgery. That'll go down. If you feel like it's really irritating to her, again, give us a call. Usually we can do a warm compress on there to help with the inflammation, but just let us know. You can send us pictures to our email or to that telephone number that you text when you come in, and we can help make sure that we're going to give you the best advice.
Okay.
No bathing. That's a really important thing. We don't want her to get wet down there at all until we see her back. Now the incision site itself doesn't have any stitches on the outside that need to be taken out. Those will dissolve, but we still like to check them in about 10 to 14 days so I can help get you scheduled for that appointment.
Okay.
Okay? Now before we go over medications, is there anything that we had went over so far that you had questions about?
I don't think so, no.
Okay. So with our medications, again, she got an injection of pain medicine while she's here today. It lasts for 24 hours. The next dose is going to be given tomorrow, and like you requested a liquid, it's going to be called Medicam, and you're going to give it based on weight. So she's 11 pounds, so she's going to get the 11-pound dose once a day, and again, around the morning time will be best for her. Now, we didn't send home any other medication. If you feel like you're having a hard time with her, wanting to rest and things like that, the doctor can always prescribe something to help keep her kind of calm and not
Sure.
sedated, but definitely more drowsy.
Tired.
Yeah. All right. And it is also important that the meloxicam is given with breakfast, because it could cause an upset stomach. So the other thing that's really important to us, just in general, is that your comfort level is as important as her comfort level while she's recovering at home. If you notice that she seems uncomfortable, let us know. We'll help you out. There are a few really important things here, like how long is it okay to go without eating, drinking, if you're seeing vomiting and diarrhea. Sometimes eating and drinking is not a huge thing. They just woke up, they went through something big. We're not surprised. Usually over 24 hours is where we'd say, hey, we should probably talk about that. Any vomiting or diarrhea, again, once or twice isn't a huge deal. It's the repetitive, constant stuff that we want to make sure we stop and get her some medication for. She is going to have a bandage on where her IV catheter was, so we want to make sure we take that out. That is a self-adhesive bandage, so it unwraps really easily. And if you have any questions, just let us know, but there's no catheter in there, it's just the bandage. And the last thing really on here is that, you know, in the event of an emergency, we have both contact information for AVETS and PDSCC, because they are the closest emergency facilities for us.
Okay.
Again, is there anything that I went over that you weren't sure about, or you still have questions?
As far as the catheter bandage, how long can I wait before taking that off?
Basically about a half an hour to an hour. It's just like when you and I give blood and we have to put a pressure bandage on, just to make sure there's no residual oozing.
All right, sounds
Okay.
good.
All right, so then if you can sign just down here at the bottom for me, that's just confirm. All right, so we'll get you a copy of this and we'll send you home, okay?
Thank you very much.
You're welcome.